The fishbone diagram is a visual way to see a cause and effect. So the cause of the readmission is through all the process, people, management, materials, and environment. So the process of discharge in this case was rushed and there was no translator used. The people involved in this cause and effect is the nurse, the resident, and the patient. The resident failed to use a translator during their discharge instruction. The nurse printed the discharge in English when it should have been in Spanish. She should have made herself available by not rushing through the discharge process. Ask the patient if he had any other questions, if he understand what the teaching that she provided to him. And the patient, he should have advocated for himself and said, I don't really understand what's going on. I need a translator, or had verbalized that he didn't understand what they were talking about. Management. So unfortunately, the patient was non-compliant with his medication for when he was discharged home. And since he was asymptomatic, he didn't have any, chest pain or heart palpitations or anything associated with hypokalemia. So that has something to do with this cause and effect. The materials involved, there was no written teaching for him to understand. So it was in English rather than in Spanish. And that also has to do with the preferred language. The environment has a lot to do with this case study. The workload of the nurses in that department is insane. They have a 4-to-1 ratio, sometimes even 5 in the emergency room in that unit. So that can be pretty difficult. Also, I'm sure the nurse was very busy, although it's not an excuse, but it is a factor in this case.